questions about what happens in settings where there's not a complete switch to an electronic platform for delivering care. Many physician practices, for example, will have some uptake of electronic technologies, but will nonetheless cling in important respects to their prior systems of patient records. This inconsistency or dual approach to documentation can create its own risks. For example, Lawrence Castellino at the University of Chicago did a study that tracked the clinicians' failure to deliver clinically significant test results to their patients. And he examined 3 different kinds of ambulatory care practices: practices that had only paper records, practices that had only electronic health records, and practices that used both. And he found that while the use of electronic health records alone can reduce the risk that patients won't receive clinically significant test results, having both kinds of systems in place was actually worse than having no electronic health technologies at all, because of these gaps between the systems. So thoughtful design around implementation turns out to be very important in minimizing the risk that the move to electronic technologies in and of itself creates new opportunities to err and to hurt patients. There arises the question of what the law will expect organizational providers along these lines. What does responsible implementation of these technologies mean? Unfortunately, the case law around this is extremely limited at present. These technologies are so new that cases haven't arisen and haven't had a chance to work their way through the judicial system in the way that results in written opinions that can give clear guidance about how judges will think about liability. But there is at least one case from a federal district court in South Carolina that suggests that courts may begin to recognize a legal duty to carry out implementation of these systems in a responsible way. For example, in this case, the Smith case, the court looked at what the hospital had to do during the period in which its clinicians were still training on the new system. An error had occurred during that training period, and the provider was sued, but the hospital itself was also sued for negligent implementation of these systems. The court held that the hospital did have a duty to carry out this implementation plan in a responsible and non-negligent way. Now, it unhelpfully provided very little guidance as to what a responsible implementation plan would look like, but said that in this case the hospital had met its duty because it had provided some redundancies in the system. Specifically, during the period in which all the clinicians had not yet trained on the system, it required all of its radiologists to phone test results directly to the providers, just in case the electronic transmission didn't hold up. It also required that the hospital make its system automatically print patient test results in 2 separate locations, so the providers would have a heightened risk of receiving those results. So that's an example of a plan that contemplates and anticipates errors happening in this implementation chasm and provides redundancies and backup systems so that the hospital is taking reasonable steps to ensure the implementation goes smoothly. Overall, the implementation period then seems to present opportunities for heightened risk. Hopefully this doesn't dissuade people from adopting these technologies, because as systems begin to mature in place, the landscape again begins to change. We have still opportunities for errors to arise, but there are also new opportunities to prevent errors from happening.